Good afternoon and welcome to GP Video Podcast by Nadia. So today I'm in Perth and attending GP24 conference organized by RACGP for all the GPs in Australia. I'm very excited to be here because there are so many topics that are being discussed here, especially the theme of this conference is how AI, which is artificial intelligence, is going to change GP world, and how GPs are not going to be exchanged by robots but going to be exchanged by the GPs who use AI. So yes, if we want to continue doing our GP practice, we need to be continuing to learn AI and implement AI in our practice. But today, the first topic apart from AI that I got the lesson for or the class for is prevention of osteoporosis in perimenopausal women. And I just wanted to discuss a few points because as you know, that I would like to make this video podcast every day, and the topic's on go. So whatever I study and whatever I learn, I just would want to share that with you guys, and then we can come back to, because I am not finished yet with medicinal cannabis, so we'll come back to that. We'll come back to osteoporosis as well, but today I would also would like to summarize in a 5 to 7 minutes video what I have learned about prevention of osteoporosis. So what is osteoporosis? It is a condition in which there is decrease in amount and thickness of bone tissue. So this makes bones weak and more susceptible to break or fracture. Now, what are the risk factors? Risk factors: sex. Women are more likely to develop osteoporosis than men. Age: the older you get, your bones become more brittle and weak, and the more you are at chance of developing osteoporosis. Then family history is very important. Then body frame. So it is understood that small body frame is actually related to increased risk of osteoporosis because there would be less bone mass. But nowadays, according to the new research, even being overweight is also related. So underweight is mostly, but now it is also understood that being overweight is also related to the increased risk of developing osteoporosis. Then hormones, because we are talking about perimenopausal women in which there is a deficiency of estrogen and progesterone. So deficiency of estrogen and progesterone put women at increased risk of developing osteoporosis, and I think that is one of the reasons why women are more at risk of developing osteoporosis than men. Then we have got parathyroid hormone when it's more in number, which is a condition called hyperparathyroidism that also increases the risk of osteoporosis. Then overactive adrenal gland also puts you at the risk of developing osteoporosis, and they also say that hyperthyroidism is also related to the increased risk of developing osteoporosis. There are other medical conditions like celiac disease, in which you are intolerant to gluten, inflammatory bowel disease, which is a bowel issue, kidney disease, liver disease, cancer, multiple myeloma, and rheumatoid arthritis. All these conditions put you at increased risk of developing osteoporosis. Then dietary factors or the lifestyle factors, which actually are the preventative measures that all males and like all women especially, and of course males as well, need to start adapting from their early life. So what is that? Number one is low calcium intake, because our calcium intake usually we cannot sometimes so it is said that we can quantify measures amount of calcium in food, but it's not always correct. And sometimes we think that okay, we are taking enough amounts of calcium from, like, let's say yogurt, milk and all of that, but then it's not always accurate. That has been researched and said that not always whatever the amount of calcium we are taking through dietary intake is sufficient. So daily 1000 milligram of calcium, 1000 milligram of calcium is needed for maintaining our calcium intake. Then vitamin D. Again, vitamin D deficiency is very much prevalent, not even in third world countries, but in first world countries as well. The reason being we do not get enough of sunlight. So the levels should be maintained between 50 to 200, and deficiency should be avoided at all costs. And usually what I do with my patients is I put them at least on 1000 international units of vitamin D, which is usually 1 capsule daily. So around 1000 international units of vitamin D, 1000 milligram of calcium daily, 1000 international units of vitamin D daily. Then low protein is again a risk factor, and we should be increasing the amounts of protein in our food as well. Then eating disorders, again, people who have anorexia nervosa, the ones who do not eat nicely, do not eat everything. And then they say that weight loss surgeries these days, like sleeve gastrectomy, which for example I have done and which I'm a big advocate for, that also puts you at the risk of developing osteoporosis. But what you can do is, if you adapt the preventative lifestyle, like you have enough of protein in your food, enough of calcium in your food, enough of vitamin D in your food, and then other points that I'll talk about, then you can easily prevent it. Then sedentary lifestyle in which you are sitting all the time and not doing enough exercises, can also put you at risk of developing osteoporosis. Aerobics and jogging are the most important exercises to prevent osteoporosis. Then smoking is also one of the biggest risk factors for developing osteoporosis, because it does a lot of factors, it does a lot of things. There are a lot of mechanisms that actually smoking does and puts you at the risk. Number one is like increasing the osteoclastic activity, which is the destruction of bone, and then it also decreases the absorption of some of the dietary factors like calcium and all, so that actually puts you. So no smoking is also very, very important. In regards with alcohol, it should be 2 standard drinks per day, not more than that. If you have more than 2 standard drinks per day, then you are at increased risk of developing osteoporosis. So again, as I said, menopause, as I said, is one of the biggest risk factors. So what is the treatment? Treatment is, as we all know, it's bisphosphonates, and hormone replacement therapy is also considered one of the pillars of treatment for osteoporosis. But as I said, today we are not talking about the treatment. We'll talk about it at some other stage. But again, I will repeat all the preventative strategies which we should be applying in our lives from 20s and 30s, if not earlier. Calcium intake, vitamin D intake, protein intake, and then like if we have sedentary lifestyle, then at least doing 20 to 40 minutes of exercise a day, which should include some jogging and aerobics. Not more than 2 standard drinks a day, and no smoking. Also, if we want to lose weight, then we have to look after all these dietary intake factors, and if we are quite overweight, then we should be losing weight but maintaining our dietary factors. So this is all about it, and I'll catch you guys soon.